Hello, welcome to this live call all about gaps. I'm going to give us a minute here. I'm just going to get my presentation up here and give a few minutes for people to come on in. This is going to be recorded, so if you have not been able to attend live, because I know that there are people here in the community all over the world, and that this time is not, no time will be practical for everybody, and that is totally fine. So I'm gonna give us a few minutes for people to come on in. I'll get the recording set up so that those of you who can't attend live can watch the recording, and we will get started here shortly. I wanna make sure we have enough time to go through all the information and to have the Q&A at the end. And so we will get started here in just a minute. Right, for best sound quality, I'm going to be using this mic. So the sound is probably going to sound different because I just switched that over. And hopefully we are all good here. All right. Well, I'm going to go ahead and open up the presentation here. And as people come on in, you can just go ahead and join. All right. All right, so hopefully you can see my screen here. I'm going to actually make this a little bit smaller. All right, hopefully you can see my screen here. And I know you are seeing my slides there on the side, and I'm good. All righty, here we go. All right, so today we are talking all about the GAPS nutritional protocol. I'm going to spend a little bit of time here. Hi, welcome on in. We have a small live group here today, but the recording will be going up hopefully later today, maybe tomorrow. But thank you for those who are here. Right. Okay, so today we're talking all about the GAPS nutritional protocol. This is GAPS stands for gut and psychology syndrome, as well as gut and physiology syndrome. And I'm going to go over the basics of GAPS. So this is not going to go into a very, very deep dive today, but we are going to talk through the really important things to know if you are considering the GAPS diet, if you've never heard about it, just how to, just the basics of what it is, and hopefully provide some clarity for anyone who's going through chronic illness or recurring illness, so that you can actually see, hey, this is probably what's going on with me, and that there is something I can do about it. Okay. So that's our plan for today, to go through the GAPS nutritional protocol information. All right, first of all, who am I? Here is a blurry little picture of my family. This is the latest picture that I have, so I'm using it right now. So my name is Holly. I am a registered nurse. I am a functional nutritional therapy practitioner, as well as a certified GAPS practitioner. This is my family, my husband, Jared, our 3 kids, Maggie, Everett, and Juniper. And this was us on the 4th of July this past year. So I have these little ones, and this is my sweet family. We live in East Tennessee. We moved here last year. We lived in Denver, Colorado before. And so we are just newbie homesteaders, like a lot of the rest of the world. We've made a migration to another area in the past, in the past year or so. And we are really loving it over here. I know a lot of you are in Tennessee, but like I said before, there's a lot around the world. So this is a very classic Tennessee 4th of July, what it looks like. So a little bit about me for you to know why you are listening to me. So I was a registered nurse, still am, but I worked in emergency departments all over the United States for over 10 years. When I had my oldest daughter, who is now almost 8 years old, when she was born, she needed to be in the NICU, in the neonatal intensive care unit, for a few weeks on life support. That was a big surprise for us. The pregnancy went well. I was very, very healthy, as much as I knew. I was very athletic. I was always busy and working and really didn't give much thought to my body. I was physically able. Had my daughter. She was intubated on life support. And that was a really stressful experience. When we got her home after a few weeks, I all of a sudden crashed. So I all of a sudden started having migraines, insomnia. I was unable to sleep for numerous days at a time. I started hallucinating, and then I started going blind. My hands stopped working. They went numb, and then I couldn't pick things up, and everything was kind of intermittent. It wasn't constant, but it was very, very frequent, like every hour maybe, that I would have an episode where I couldn't see, couldn't use my hands, and then maybe an hour later it would fade away. Another hour later it would come back, and I was really scary. So I was still a nurse in the emergency department, talked to a bunch of colleagues, different doctors there, and everybody thought that I had maybe MS, maybe a brain tumor, not really sure what was going on. And that was just a kind of a time of eye-opening for me. I thought, why in the world would I be completely healthy? I'm feeling really good. And all of a sudden I have, I have my first child, and then I have MS or a brain tumor? That does not make sense. So I started looking into, what can I handle? What can I manage, or what can I be in control of here at home? And that was primarily my diet. My exposure to different things, where I went, who I was around, and what I ate. That was the main things that I can control. And once I started pursuing, looking at, first I started looking at Candida yeast in my gut, because when I was doing just internet searches, things came up with maybe there's a yeast kind of thing. And so I did a Candida diet, and then I did kind of a GAPS form of Candida diet. And I was having all my symptoms for about 3 months. And within about 2 weeks, all of a sudden my symptoms were gone, completely gone. I was joyful. I didn't mention, but I had tremendous anxiety, which is never something that I experienced before. But in that postpartum time, tremendous anxiety. And all of a sudden, it felt like it was just lifted. I was joyful. I was peaceful. I was sleeping. My vision returned completely. I was able to use my hands again and lift my daughter without being scared of dropping her. And it was a very quick transition for me. So then I realized, okay, there is something to this. Food is tremendously powerful. I went back to school to become a functional nutritional therapy practitioner so I could really understand the body better in a way that I hadn't learned in nursing school, in a way that we weren't talking about in mainstream medicine, and learned on that level of naturopathic health. And then I went on to become a certified GAPS practitioner and really deepened my own healing, and then was able to use the GAPS protocol with a lot of other people, my family, my extended family, and then many, many, many patients of mine. All right, so that's the basics of me. I could share a whole lot more of my story, but that's the main things to know. We're going to talk about the gut today. Hippocrates famously is quoted to have said, all disease begins in the gut. And this is true in the premise of the GAPS nutritional protocol. So GAPS stands for Gut and Psychology Syndrome, as well as Gut and Physiology Syndrome, like I said. The GAPS nutritional healing protocol is what we are talking about today. So GAPS is kind of the term for the syndrome, for the people going through this. So we refer to them as GAPS people. The GAPS nutritional healing protocol is what to do about it. So we're going to talk through what is the purpose of GAPS, which is right here. Okay, so what is the purpose? We're going to heal leaky gut. We want to heal the body. So once we heal leaky gut, then we start healing the rest of the body. We start reducing symptoms, and then we start to see a thriving life. which really is the sequence that I saw in my own life. So I first worked on my gut specifically. I wasn't working on specifically on sleep or specifically on my eyes, but I worked on my gut. Then I started realizing, oh, there is healing going on in the rest of the body. I saw that reduction in my symptoms, and then I really was able to have a very thriving, joyful postpartum following that. So leaky gut, since this is where we start, let's talk about what it is. So leaky gut, we're talking about the digestive system. Leaky gut is kind of I'm so thankful that it's been, let's see, a bit of a fad lately maybe, but the fad is not the right word. It's kind of become a hit term. And usually I don't like that, right? When things are like, oh, there's histamine issues or MTHFR. There's a lot of different kind of terms that are thrown around that everyone's like, oh, I think I have that. Oh, I think I have that. And I think a lot of times it doesn't serve the population well when you're trying to put names on all these different things that maybe you have. However, I really am glad that leaky gut is being talked about now. I did not learn about leaky gut in nursing school, which is about 20 years ago now. I didn't learn about it. Nobody was talking about it. When I worked in the emergency department, if somebody came in talking about their microbes or yeast overgrowth, we didn't have tools to handle that. We gave, antifungals. It was only medication to, oh, you have an overgrowth of something. Let's just quench that, right? Let's give an antibiotic or an antifungal or, anti-yeast type medications. There was not an understanding of what leaky gut is at all. And I think it's maybe common knowledge now, but really the medical system is significantly behind. Usually they say it's about 18 years behind the research, or at least that's what the latest statistic that I've heard. And so I think now really it's becoming more of a mainstream term, which is beautiful because it's responsible for so much. And if we can heal leaky gut, we're gonna see healing of so many other chronic illness and chronic symptoms. All right, so leaky gut, we're going to talk through the digestive system. So the digestive system is one long tube stretching from mouth to anus, right? There's a lot of other things involved here, the brain and the hypothalamus and the pituitary and the thyroid and the liver, all of that. However, the digestive system is just this tube. So mouth down to esophagus, stomach, small intestine, large intestine, anus. That's what we're talking about in the digestive system. All throughout the digestive system, also all over our bodies, our skin, our eyes, our sinuses, all over, we have flora or bacteria or microbes. So bacteria and microbes are not synonymous, but bacteria are a type of microbes. So we have microbes all throughout our bodies. In the digestive system, like we're talking about, especially in the intestines, we have beneficial bacteria, opportunistic microbes, and pathogenic microbes. So these are kind of what they sound like. Beneficial bacteria are beneficial to our bodies. They help us to be strong and resilient and healthy to function how we should. Opportunistic microbes they could go either way. They could be beneficial, they could be harmful. It kind of just depends on the terrain of our body, how our body is doing, what's stronger in different times. The opportunistic microbes could go either way. And then the pathogenic microbes, pathogenic is disease causing. So these are the ones that are disease causing. Now, these microbes are not necessarily bad. I don't like to say bad microbes because truthfully, if they are under control, if they are suppressed and they're in a good balance with everything else, they can actually be beneficial for different purposes in our lives. But when they are too elevated, when they're too strong and prolific, then they do become pathogenic. So these are the kinds of flora that we have in the digestive system. All right, so let's talk about the strong beneficial bacteria. So when we have strong beneficial bacteria in our bodies, that means we have strong and healthy enterocytes. Enterocytes are these little guys that you can see on my slide here. They are the cells that line all of the intestines. And I'll show you another picture here in a second so you can see them on the intestines. But when the enterocytes, when these cells are healthy, we have a strong gut wall, we have strong immunity, we are able to produce vitamins, the vitamins that we're not getting from our food, we're able to produce those in our gut, some of them, and then we have really good digestion and absorption. These enterocytes have these hair-like substances, these projections, and these are digestive enzymes. They help to determine when you eat something. So you have a hamburger and you chew it really well, and it's a good quality hamburger and it's really beneficial. It goes down into the intestines. This enterocyte here, those hairs are going to identify, oh yeah, this is a good, well broken down nutrient. I want this. Allow it to go through to the bloodstream. As long as it's beneficial, it'll go through to the bloodstream and then it'll serve its purpose. Now, also, say you have a processed food and you eat that, the enterocytes, or these digestive enzymes on the enterocytes, are going to actually say, you know what, that is not beneficial. Nope, you stay in the digestive tract. Do not go through to the bloodstream because that's not going to be beneficial. And it makes it just go on through the digestive tract. So these are really, really important for digestion, for keeping us healthy, for keeping our bodies run really well. This is the next picture here. It's a little bit blurry on here, but these pictures, these cartoon images are taken from the GAPS. There's two main GAPS books. There's the Gut and Psychology Syndrome book, which is where I took these from, and then the Gut and Physiology Syndrome book. So these were created for the official GAPS books here. So this one is an image of what is going on in the intestines. So the intestines have these, they're called finger-like projections, which are villi, and they are going and kind of going up and lining all of the intestines. Now, when you look, you can kind of see a shading on these. That is the hair. So all these little circles lining each one of these, it looks like little beads going over, those are the enterocytes with the hair. So as long as that hair of theirs, it's not really hair, but we're calling it that, as long as that hair is strong and intact and healthy, it's creating a barrier between the intestines and the bloodstream. But if those are not healthy, kind of like that previous picture, you see that unhealthy one, the sick enterocyte, then their hair gets all kind of relaxed there, and it creates pores or holes where there shouldn't be holes. So then you have maybe that processed food, that chip or that pretzel or whatever it is. And while the body wants to say, no, that's not beneficial, don't go through, there's holes and the food can slip right on through. That can cause massive havoc in the body, as there's suddenly a foreign body in the bloodstream. And so then the body has to say, hey, what is this? Let's attack this. Let's get this out. This is not supposed to be here. The body's being very, very smart in creating inflammation, in creating a immune response to the foreign body that's going on there. Okay, let's talk a little bit more about these enterocytes. So the way that enterocytes are supposed to be, so this is the little villi, right? The villus that we just looked at, and they are born down at the bottom. There's that cute little maternity unit on this image. So they're born down at the bottom. They should be born beautiful and healthy with those really strong hairs. And as they get older, they progress up. As they get to the very, very top, that's when they are kind of getting older, dying, and then they slough off. That is how it's supposed to be. The problem with when we are not healthy is that these little guys are not being born healthy. So rather than being born healthy right out of the maternity unit, they actually come out looking more like one of those decrepit and sick little ones. So then that is just exponentially making the gut more porous and more leaky, so that things can go through and that we don't have protection against foods that are not beneficial for us. All right, so we talked about this a little bit, but what feeds the enterocytes is the beneficial bacteria. So if we have strong beneficial bacteria, we will have strong enterocytes. If we have strong pathogenic microbes that are not helpful, they surge out of the levels that they should be in, then we're going to see the following things. The enterocytes become sick, they travel slower, those hair-like projections do not filter well. We have a decreased amount of absorption of positive beneficial nutrients. Those tight wall junctions loosen and it becomes porous and leaky. We have nutritional deficiencies because we're not absorbing and utilizing food appropriately. The immune system suffers because first of all, it's not fed well because it doesn't have the nutrients it needs. And second of all, it's on hyper alert basically all the time. And then this is when we start to really see symptoms. Sometimes we see symptoms earlier, but at this point, we're definitely seeing symptoms of illness, of unwell chronic illness. When the wall is porous, undigested food travels through the bloodstream. The body starts attacking the foreign bodies in the blood with this hyperimmune response, and then symptoms develop. So this is kind of a recap of what we just talked about there. This is the basics of leaky gut. All right, when we have leaky gut, both the body and the mind are always affected. So typically when I have somebody come to me because they are having symptoms and they maybe heard that I'm a GAPS practitioner, they want to work through GAPS with me, usually, well, let's see, some of the time, they come and they say, I have, digestive issues, I have chronic diarrhea, or I have joint issues, I have chronic joint pains, I have eczema is a really big one, I have acne that's really horrendous, I have infertility or hormone issues. A lot of times there's more of that physical component, or I'll see, hey, I have anxiety, I have depression, I have bipolar or schizophrenia. A lot of times we'll see somebody is more concentrated either physically or mentally. However, in a situation of GAPS, there's always going to be a progression where the body and the mind are both affected. So while someone might say, you know what, actually mentally, I feel really, really good. I just have the chronic diarrhea and some rashes, some eczema or psoriasis. It actually is that there is a mental component going on. There is just the physical is more in the forefront, right? It's more of what is obvious to the person, and they may be preserved mentally for right now, but if GAPS is allowed to continue on, if that leaky gut is allowed to progress, we are going to see mental components with that, because anytime the gut microbes are out of balance and there's a surge in pathogenic microbes, those do provide neurotoxicity and cause issues in the mind. Now, like I said, some people come to me and they're like, you know what? Physically, I feel great. I'm an athlete. I can eat whatever I want. I have no problems, but I'm super anxious. Again, that's the main thing that's on the forefront. But what they probably don't know is that there's liver involvement or gallbladder involvement, or maybe some lymph issues along with the leaky gut that we need to address. And if it goes untended, they will start seeing those physical issues later. So this is a big thing to remember. Both the mind and the body are always affected when there is the gut and physiology syndrome or the gut and psychology syndrome. All right, common symptoms. These are things that I often see in people who have GAPS: eczema and other skin issues, anxiety and depression, bipolar, schizophrenia, chronic diarrhea or constipation, abdominal pain and bloating, fatigue, PMS, fibroids, autoimmune disorders, seizures, poor sleep, and brain fog. There's many more, but I see these in the majority of the people that I work with one-on-one right now. Now, we could deep dive into every single one of these because there are reasons for these, right? Specific microbes that do create different things, specific nutritional deficiencies that make you more prone to have the diarrhea or the constipation versus the seizures. So we could deep dive into all of these, but we're just going to kind of surface right now. But I'm happy to answer questions about these later on. Okay, so we've talked about the symptoms and what's affected and what happens when there's bad more pathogenic microbes and not a good balance in the microbes in the gut. But there is good news. We can heal. Healing is possible. So my point of view, and this is, I'm not speaking straight from the GAPS books or training here, but my point of view is that we were created intentionally. Humans were created intentionally for a purpose. We are not just an accident in this world. And our bodies were created brilliantly to be able to heal when we supply them with what they need. So when we can supply the nutrients that they need, when we can remove toxicity and help the liver repair and help the microbes repair and help seal the irritated gut lining, then we can heal. And I have seen tremendous healing happen among people who were told that they simply were unable to heal and that medications to quench symptoms were the only option. But there truly is the good news that healing is possible. I don't think that it's ever impossible to heal. So how do we do it? Okay, the main three things that we start with are we want to stop the offending agents. So things that are specifically causing the bacteria to be out of balance, the beneficial bacteria to be low, the pathogenic microbes to be high. We want to stop those things. We want to nourish the beneficial bacteria, and then we want to patch up those holes that have formed in the gut lining, because it does take a long time to get those enterocytes healthily coming out of the maternity unit again and really, really strong and healthy. It takes time. We want to patch up those holes as we're getting the body to be more healthy. All right, so first of all, what are the offending agents? These are the main things that I see. Again, not a comprehensive list. However, these are the things that I see typically causing irritation to the gut lining, causing damage to the enterocytes, causing the pathogenic microbes to be very strong and healthy, and the beneficial bacteria to be suppressed. So processed and fake foods. This is really anything that, ultra processed, things that are coming from the grocery store with tons of ingredients in them, in a box, in a can, whatever it is. These processed and fake foods are very difficult for the body to identify. They do not have beneficial substances in them for the most part. When they have fortified nutrients like fortified calcium or fortified B vitamins, it's rare that we can actually process those. So these are definitely more feeding. They're usually full of sugars and chemicals that feed the candida, different kinds of yeast, parasites, other kinds of microbes, fungi in the intestines that are not beneficial. Sugars, again, similarly, just like the processed and fake foods, sugar is irritating on the gut lining. It increases our stress hormones. It does change the environment of our immune system, suppresses our body's ability to be strong, and then it grows those pathogenic microbes. Synthetic chemicals, these do the same thing. These provide stress on the body. The liver is really important with healing, and the liver is really important for hormone regulation and for the body to be able to process out normal wear and tear that goes through the body. Synthetic chemicals, processed foods, sugars, all of these put additional burden on the liver and make it harder for the liver to do the job that it's really meant to do. So body products, different kinds of lotions and makeups, and certainly fragrances, most shampoos, conditioners, really anything that you put on the body. There's some statistics that have been shown that anything you put on the skin absorbs within about 15 seconds into the bloodstream. So that's why anything that I use on my skin is something that I would feel safe eating. Maybe I don't want to eat it, but I would feel safe eating it because it's going to go right in basically to the same place. So body products, cleaning supplies, these are things like your bleach and your chlorine type products and all different synthetic, window cleaners that have the synthetic lemon fragrance and things like that. All of those are going to cause a lot of stress and burden to the liver. Medications do the same. Vaccines do the same. Medications and vaccines also often contain additional harmful substances, such as heavy metals, formaldehyde, things like that. Nutritional deficiencies. So just if you start off nutritionally deficient, where you're not getting enough of some kind of food, such as if you have a low-fat diet, if you're coming from a significantly plant-based diet, these can cause nutrient deficiencies, which don't allow appropriate growth of the beneficial bacteria. Stress, pathogenic microbes that are passed down the birth canal. This can be from both mom and dad. So a lot of people they start off their life like this. So it's really great if we can get moms and dads or women and men before they have babies or before their next baby to really do some good cleansing, and doing the GAPS diet can be so beneficial to their children. Formula like baby formula is extremely offending to the gut lining. Anything that's powdered. This does include even many organic formulas, or the really great goat milk formulas. They're still going to produce stress and still have an abnormal effect on the gut lining. Sometimes they are appropriate for the situation, but I always start babies who've been formula fed on a specific kind of baby GAPS diet, which I have a course for that, a specific baby GAPS diet to help them wean off formula and get onto real healing food soon. And then environmental toxins, so pesticides, water, glyphosate that's all over the place, even things like EMF and different substances that we are around. I said water, but I meant toxic water, right? Things that are in the water, fluoride, chlorine, things like that can be very damaging as well. All right, so now once we have gotten rid of as many of the offending agents as we can, now we want to nourish the beneficial bacteria. This is where probiotics come in. There are three main categories. So there's commercial probiotics, like a capsule that you could get. There are fermented foods and drinks like beet kvass and kombucha in some cases is really helpful. Things like sauerkraut or kimchi, cabbage tonic, and I have a lot of recipes for these on my, I've recipes for many of these on my website. Cultured dairy like sour cream or creme fraiche or yogurt or kefir. These are all great examples of probiotics. And as we have these, we're going to really be boosting the beneficial bacteria in our gut, suppressing the pathogenic bacteria and different microbes in our gut. And then we'll start seeing a lot of relief from the symptoms. And then finally, we want to heal and seal the gut lining, which is patching the holes up. This, we primarily use meat stock for this, which is not bone broth. Bone broth definitely has some benefit to it, but on a significantly leaky gut, bone broth can be more irritating. So we always start with meat stock. The main difference is, because many people are familiar with bone broth, but not necessarily with properly prepared meat stock. So the main difference here is meat stock has meaty bones. It's not just bones that you have, frozen from something else that you cooked and then you put that all in a pot. It's meaty bones. You want to have a ratio of about 80% meat to 20% bones. And so a whole chicken, some oxtail and short ribs, and maybe some extra beef thrown in there. You can use lamb. You always want to be using meaty bones, so that 80%-ish. You don't have to get so technical about it, but around 80% meat to 20% bone, and those bones should be joint bones. A short cook time is what we're going for. So rather than a bone broth that can be there for about 12, 24, 72 hours, we want to do a short cook time. So chicken would be about 2.5 hours. Beef or lamb would be roughly 4 to 6 hours. So you can use any kind of meat. You can use fish for this. You can use game. You can use poultry. You can use red meat. It really doesn't matter as long as you're sticking with these guidelines. And then we also want to use a small amount of water. So with bone broth, where you'll put a whole bunch of bones in and probably some vegetable scraps and maybe some apple cider vinegar, and then fill the pot up with water. We're not doing that. We're going to just put all the bones in, cut up so the joints are exposed, put all of the bones in with the meat on it, and then we're just going to add up to about 2 inches of water over the level of the meat so that we can have a really nice concentrated, thick, gelatinous stock. When you drink it, when it's warm, it doesn't feel gelatinous. It just feels delicious. But when it cools, it should have a gel to it. All right, so those are the main things. We're going to stop the offending agents, we're going to nourish the beneficial bacteria, and then we're going to heal and seal the gut lining. Now, we do need to do this in a very specific way. So let's talk through the basics here of the GAPS, the actual protocol. All right. So overview of the protocol, there are two components, or there's two main parts of the GAPS diet, the GAPS nutritional protocol. There is the introduction part and there is the full part. So introduction GAPS or intro GAPS and full GAPS. The criteria, and we'll go through the two of those. The criteria for food is that they are properly prepared, that they are real foods, that they are healing, they provide a lot of nutrient density. And then we start with easier to digest foods and we progress up to harder to digest. The length of time, the GAPS protocol is truly was it originally created to be a 2-year protocol. That is a 2-year, about a progression as you go through introduction onto full. Some people go through it faster, some people take longer, but about a 2-year time frame is what you're looking at to really be pouring into the gut healing components of the protocol. And then your end goal is healing. So whereas a lot of elimination diets just kind of eliminate so that you can feel better, this is not simply an elimination diet. We're not just taking food out and then saying, good luck to you. I hope you can enjoy those 4 foods that you can eat. No, the goal of this is to heal so that when the lining of your gut is healed and sealed and your beneficial bacteria are strong and robust, that you can have a food that's not necessarily great for you, or maybe that you reacted to before, and your body is going to take from it what it can, and it will allow the rest to process on. So the end goal here is healing. We don't ever want people to come off of GAPS and then go into a poor quality diet after that. That's not good for anyone, and that will cause more irritation and kind of set you back. However, if you can get on to, from GAPS, the goal is for you to get onto a good, nourishing, whole foods, real foods diet and experience that thriving life that I was talking about earlier. All right, so what is introduction GAPS? So there are 6 stages of introduction GAPS. This is the more intense place to start. So there's a higher intensity of healing that goes on in introduction GAPS. So many times people will start here with introduction and then realize, oh, this is a bit too intense. I'm not able to actually tolerate it. It's too stressful on my body or for my family or with my work schedule is too intense right now. And so I often have these people start on full GAPS first for a period of time and then come back to introduction as needed. But some people are fine to just jump right in. That's what I did. That's what was most effective for me. That's what I really needed. And some people I do have start this. Die off is a component both of introduction and of full GAPS. Die off happens when you are killing off the pathogenic or the disease-causing microbes, and all of them do have toxicity inside them. So as they die, which is good, they will release toxins, and this can cause a temporary surge of symptoms. Maybe it's a rash, maybe it's anxiety, maybe it's brain fog, maybe it's a diarrhea, but this is something that can happen and it's a good sign, and then it comes on down. One thing we do need to be attentive to is that we don't want to stress the body out too much. So if the die-off is too intense, then we need to back off some of the healing foods, the probiotics, maybe some of that meat stock, allow the body to relax a little bit and then go back into it. Sometimes it's appropriate to push through die-off, and sometimes we need to back off a little bit, just depending on how the person is tolerating it. I ask a lot of people, or I have a lot of people ask me, well, can I just do tons of probiotics and do everything so fast and just get all of it done and feel miserable for a while, but then get off on the other side of it? And my answer is really no, because if you stress your body out too much all at once like that, it can cause more complications. So we do need to be careful with the amount of die-off and monitor that. The length of time with each stage, so there's 6 stages. Every single person is going to need a different amount of time. We generally say a minimum of a week on each stage, but some people do need to be for longer months, some people even years on certain stages. But typically, we're going to start with a week on each stage, see how the body is doing, and then advance up to the next if they are ready. And there are certain criteria to know if you're ready for the next stage. And then there are specific foods for each stage. So let's look at those. I'm not going to go through all of these for time's sake, so we do have enough time to answer some questions. However, the main things are that you're going to start with things that are very simple, easy to digest, easy to absorb, very, very nutrient dense, and building and healing. The first 3 stages, 1, 2, and 3, are all about building. The second 3 stages, 4, 5, and 6 are very cleansing. Plant foods are very cleansing. Animal foods are very building. So in general, we're going to be doing a lot of animal foods there in stages 1, 2, and 3, soups, cultured dairy, if you can tolerate that. If not, there's a specific protocol for getting you through to being able to do dairy, if your body will be able to. Different kinds of fermented vegetable juice for those probiotics. A lot of meat and fat are the primary things here in stage 1. And then we're going to bring in some raw egg yolk and some gravlax or fermented fish in stage 2. Then we do some more scrambled eggs and fermented veggie pieces, avocado in stage 3. Stage 4 brings in some more of the produce so that we're getting more of this cleansing aspect. So the fresh pressed juices. We can cook things a little differently now. So not so much soup, but maybe more fried or baked foods, the olive or other cold pressed oils. And then 5, we're bringing in more different kinds of raw things. 6, we're doing some more fruit. So it's just a progression of the most nutrient dense, simple, healing, easy foods to more complex foods as we go along in the introduction stage. Once you finish the 6 stages, then you move on to full GAPS. So let's talk about full GAPS. So the intensity here, it still can be quite intense. It depends on how extensive the leaky gut is, how great the imbalance of microbes are in the gut. So this could also be very intense. I've had people on full GAPS where it was very intense healing, and I've even had some people who only needed full GAPS because once they did that, it really changed their lifestyle, the environmental toxins, the different things they were engaging with. This was what they this was actually really all that they needed at that point. There is also, like I said, there's some die off here too. So the intensity, the die off, those go together. I would start on full GAPS versus intro for somebody who's pregnant or breastfeeding. I do not want to start on intro for those, except for in pretty extreme cases of illness. For a lot of people who are on a standard American diet or who are just not really eating good, properly prepared foods, then starting in full GAPS is appropriate for several months to be on full GAPS, and then potentially be going into intro. For people who have a very demanding schedule, who are out of the house a lot, who don't have time to be cooking as much of the meat stock and the foods as we need. If you are traveling a lot for work or for the holidays or something like that, then I would start on full GAPS at first. The length of time of full GAPS. So like I said, I would first start somebody on full GAPS if necessary for a couple months, see how they're doing, and then potentially go into full GAPS. Intro GAPS. If you start on intro GAPS, introduction, then you'll work through the 6 stages and then usually want you on full GAPS for the remainder of 2 years. But this is very subjective. This is very dependent on each individual person, the length of time. Okay, foods in full GAPS. Let's talk about these. So there's a lot more, it's much looser, though we are still sticking with properly prepared, nutrient-dense, whole foods that are beneficial for the body. So our do's on full GAPS are any meat, any seafood, any non-starchy vegetable. So we don't do potato, sweet potato, corn on GAPS. Any fruit, any animal fat, any fermented vegetables, cultured dairy, meat stock. Bone broth is okay here if you have gone through the introduction diet first. If you have started on full GAPS, then we don't do bone broth. But if you've gone through intro and your body has done a tremendous amount of healing and you're able to tolerate bone broth, then you are able to do it here. Eggs, dairy products, sprouted beans, seeds, nuts, and their flours. What we still do not do on full GAPS are processed foods and synthetic chemicals. We do not do starchy vegetables like potatoes, sweet potato, corn, like I said. We don't do grain and flours, including gluten, including gluten-free flours and sprouted grains. So we don't do really grains of any type at this point. We don't do sugars, including maple syrup, stevia, monk fruit, agave, coconut sugar. We do honey, though. Honey is something that is allowed. We don't do pastas and couscous and rice and quinoa. Most beans, just certain beans that are sprouted, and then also chickpeas and hummus. So legumes are often not beneficial. This is the basic list of full GAPS. Okay, so how do we go about doing GAPS? So this is a very brief rundown of what the GAPS diet looks like. Then we want to decide, well, can you just do it on your own? Can you take this PowerPoint presentation, or can you read one of Dr. Natasha's books and go ahead and do it on your own? And there are many people who have. However, the reason I became a certified GAPS practitioner was because everybody is different, right? So not everyone can simply pick up a book and follow exactly and then go from one part of healing in a linear motion go to another part of healing. Most people do need guidance. I would actually never do it alone. If you want to do it without a practitioner, at least you have to have a group of people. Join a group. There's social media groups. There are groups that I run. There's different kinds of groups that a lot of practitioners run. You need to do it with people, because there's always going to be things that come up. Hey, I have this rash. Is this a good sign or is this a negative sign? Do I push through this or do I pull back? That it is so person specific that you need to make sure you have somebody. I do recommend doing it with guidance, at least for the very beginning of it. Often people can start on full GAPS by themselves, do the kind of the basics, start removing foods that are on the no list. And then when they jump into introduction GAPS, or when they're seeing some different symptom movement, then we want to work with a practitioner. Now, again, I think that everybody should be in charge of their own health. I think that it's really important for us to not say, oh, can't do anything on my own. I have to, I'm not smart enough to do this. I'm not smart enough to research. I have to have somebody. I think it's very important for anybody, whether you're doing it by yourself without a practitioner or doing it with a practitioner. You are your health advocate. You're the person in charge of your body and your healing. You should be researching and learning as much as you can, and understanding your body. And as a practitioner, that's really what I try to do. I try to help, I try to help my patients understand, what does this symptom mean? What is the body trying to say to you right now? How to understand the language of the body so you can interpret it and know how to respond to it, versus just following just a protocol of rules. So alone or with guidance is completely up to you, but I do highly recommend at least have a group. And then when you start having movement of symptoms, you're seeing different things coming, going, ebbing, flowing, or if you're seeing nothing happening, then to get some professional guidance. So what guidance is available? There are certified GAPS practitioners like myself. There are certified GAPS coaches. So the difference between a practitioner and a coach: a practitioner does have other healthcare, medical, other kinds of experience. A GAPS coach is a layperson who has been through GAPS themselves and have gone through the GAPS coaching course. Very, very beneficial, but also a different scope of practice. There are different courses, like the Getting Started on GAPS course, which is created by a colleague of mine, good friend. There's the Baby GAPS course that I created if you want to take your baby through GAPS. So first foods, usually for a formula-fed baby, we start around 4 months, and for a breastfed baby, we start around 6 months. This is not wean off of breast milk, but it does help you approach food in a really beneficial way. So not just following the recommended guidelines that you'll see typically out there in the mainstream sources, but actually using foods that are going to set your child up really well, to be able to not have issues with allergies and intolerances and autoimmunity and eczema, things like this. There are the GAPS books, the Gut and Psychology Syndrome book, Gut and Physiology Syndrome book, and many others. And then there's the website, that's gaps.me, and there's FAQs there that Dr. Natasha, who created the GAPS protocol, answers herself there. So there's quite a bit of guidance available. Practitioners and coaches are found on the GAPS website as well, or you can reach out to me.